Hello everyone and welcome to Boundless Dentistry. In this video, we'll talk about some basic terminologies and concepts that you should know in periodontology to get started with studying periodontology. So in this video, we'll talk about every basic terminology and concept that you should know. So let's get started. Now, in this clinical picture, you can see that these are the teeth, lower teeth, and you can appreciate that this is the gingiva. However, you can see that there is some deposition which is present over here. It is yellowish and whitish and grayish in color. It's a mixture of these three colors, and you can appreciate that this is present over here between the teeth near the gingival margin. So this is called as plaque. Now, what is plaque? Plaque is basically a soft white, gray, yellowish deposit that forms the part of biofilm which is present around the teeth after you eat any kind of food. Now, the plaque basically adheres to the surfaces of the teeth, not only to the surfaces of the teeth, but also to restoration and prosthesis as well. So, this is plaque all over. You can see around interdentally and around the gingival margin as well. So, this is the first thing that you should know in periodontology, that is plaque. Now, again, in this clinical picture, you can appreciate that this is the maxillary teeth and this is the mandibular teeth. Now, here around the mandibular teeth, you can appreciate that this is some yellowish, whitish deposits which are present over here, and these are relatively softer as compared to plaque, which we discussed in the previous slide. So, this you can appreciate that this is white, soft deposits which are present around, and this is called as materia alba. Now, what is materia alba? Basically, it's a soft accumulation of bacteria and tissue cells, but it appears quite similar to plaque. However, there are some differences which you should know between materia alba and plaque. The main difference between them is there is lack of organized structure as compared to plaque. So, the main difference that you should know is that materia alba does not have organized structure as compared to dental plaque, which has an organized structure. Now, another important difference between plaque and materia alba is that materia alba can be easily removed when you spray water around. For example, in these teeth, if you spray water, so this will quickly be removed. However, plaque will not be removed and plaque can be removed by brushing. So, this is materia alba. Now, thirdly, in this clinical picture, you can appreciate that this is the lingual view, and in this lingual view, you can appreciate that these are the teeth, and you can see these are some hard deposits which you can appreciate over here. They are yellowish and whitish in color, and they're present around the lingual aspect of these incisors. So, these hard deposits are called as calculus now. Calculus are basically hard deposits which are formed from plaque. Basically, when plaque is present for around more than a week, 2 weeks, so if that plaque is not removed by brushing, it basically mineralizes, and that mineralized structure is called as calculus. So this is calculus, and this is important because this calculus, if not removed, leads to periodontal diseases such as gingivitis and periodontitis. Now, at times you can see that, for example, this calculus is present, and on this calculus, since this is a rough surface, plaque can also adhere to it. So commonly it is seen that around calculus, plaque also is present over on it. So this is about calculus. Now moving on towards the fourth definition, which is important and that you should know, is called as pellicle. Now, pellicle is basically a non-shedding hard surface which is present on the tooth, which basically provides a substrate on which bacteria can act. So this is the simplest definition you should know about pellicle. Now, the oral cavity consists of oral mucosa, and there are different types of oral mucosa which is present. For example, we have buccal mucosa, which is a different type of mucosa. We have gingival mucosa, a different type of mucosa is present on the dorsum of tooth. So, there are different types of mucosa that you should know. And firstly, gingiva and the hard palate. On the gingiva and on the hard palate, the mucosa is called as masticatory mucosa because it's relatively harder as compared to the other mucosa. This is called as stratified squamous epithelium. So this is the mucosa which is present on hard palate and gingiva. The next type of mucosa which is present on the dorsum of the tongue, the top surface of the tongue, is called as specialized mucosa because it has taste receptors. Therefore, it is called as specialized mucosa. The third type of mucosa, which surrounds the remainder of the mouth, is called as oral mucous membrane, or you can also call it as non-stratified squamous epithelium. It basically lines the entire rest of the oral cavity besides gingiva, hard palate, and dorsum of the tongue. Now, gingiva is basically that part of the tissue, as we saw in the previous slides, is that tissue which basically surrounds the tooth, covers the alveolar process in which the tooth is actually present, and it basically surrounds and protects the teeth and the alveolar mucosa. Now, moving on towards further types of gingiva which is present around the tooth, it's basically divided into three categories anatomically. First, we have the free or unattached gingiva. You can see, or it's also called as marginal gingiva. You can see that this gingiva, which is relatively free, and when you use high pressure air, so this also moves a bit. So that's why it is called as free, unattached, or marginal gingiva. Now, the next type of gingiva, which is relatively more resilient and attached firmly to the tooth, is called as attached gingiva, which you can see in this diagram is this part of the gingiva. Now, another gingiva which is present between the tooth, between two teeth, is called as interdental gingiva, as the name suggests. Now, between free gingiva and the attached gingiva, there is a demarcation which is called as marginal groove, which basically separates the two type of gingiva. Now, between attached gingiva and alveolar mucosa, we have a demarcation which is called as mucogingival junction. So this is the anatomical classification of gingiva. Firstly, we have free, unattached or marginal gingiva. Then we have attached gingiva, and then we have interdental gingiva. So these are the three types of gingiva which you should know and which is very important. Other than that, there is this gingival sulcus, which is basically a normal space which is normally less than 2 mm, and that's a normal space which is present. Now, talking about firstly marginal gingiva in detail, in this clinical picture, you can appreciate all types of gingiva we've discussed in the previous slide. Firstly, in this slide, we'll talk about the marginal gingiva, which is this gingiva which is present directly on the tooth. So, marginal gingiva is basically that gingiva which forms a collar and surrounds the teeth in a collar-like fashion. Now, it is basically differentiated from attached gingiva on the basis of this free gingival groove which is present. So between the attached gingiva and the free gingiva, we have a free gingival groove which is present over here. So it's basically a demarcation between the two types of gingiva. Now, further talking about different types of gingiva, firstly let's talk about gingival sulcus. Now, gingival sulcus is basically a space, or you can say shallow crevice, which is present around the tooth in the buccal side, in the mesial distal side, and the lingual side, is basically present and less than 2 mm, which is normal. Now, this sulcus is basically V-shaped and it allows the periodontal probe to pass through it, but till 2 mm, which is normal. If it goes beyond that, that is not normal. So we take a range of 2 to 3 mm, which is normally considered as being normal, and beyond that, that is considered as pathological. Now, moving on towards attached gingiva, this groove which is separating free gingiva and attached gingiva, this space is called as, or this gingiva is called as attached gingiva, which is associated, or you can say continuous with the marginal gingiva by being separated by free gingival groove. Now, this is firm, it is resilient, and is tightly bound to the periosteum of the alveolar bone, which is the bone in which the tooth is actually present, and this is coral pink in color. You have to remember this term coral pink because that is the normal color of a healthy gingiva. And in sometimes you can also appreciate stippling effect. Mainly you can appreciate stippling effect in the maxillary central incisor. When you use a triple syringe, you blow some air and you can see some dotted orange appearance, something similar like that. So that is normal. Now, when we talk about attached gingiva, the attached gingiva is separated from the alveolar mucosa by mucogingival junction or border. So that is all about attached gingiva. Now, let's talk about interdental gingiva. Now, interdental gingiva is basically this gingiva. You can see cone shape, or you can say pyramid shape, inverted pyramid shape. This is called an interdental gingiva, which is present between two teeth. So this is interdental gingiva. which basically occupies the gingival embrasure, this triangular shape. If this interdental gingiva is removed, we can appreciate a triangular space which is present, and this is pathologically present because in cases of periodontal diseases, this gingiva recedes in the apical direction, thereby exposing this gingival embrasure. Now, this is flattened in cases of molars in the buccolingual direction, and they have more of a cone shape. So this is all about interdental gingiva, and you have to know all of these points because these points basically forms the basis of everything that you need to know. Now, just an overview between what are considered as normal gums and what might be considered as abnormal, and you can say receding gums due to any periodontal disease. Now, you can appreciate that in normal cases, this is firmly attached to tooth. The gingiva is firmly attached, and if you use a periodontal probe, so this space will most likely be not more than 3 mm. So that is considered as normal. But in cases of, for example, periodontitis, inflammation of the periodontal tissues, you can see that the gingiva which should normally be present over here, if you compare these two pictures, it should normally be over here, but as you can see that this is receded in the apical direction, in this direction. So it has basically receded in this apical direction. So this is called as receded gum, and this is considered as abnormal. This is not normal. This picture right over here, this is considered normal, and this is considered as abnormal, and this eventually leads to tooth mobility and even loss of tooth if it is not treated right on time. So this is just an overview between normal gums and receding gums, which is very important to know. Now, taking the concept that we just learned in the previous slide, that is called as periodontal pocket, which is abnormal, this is not considered as normal, is basically when the gingival sulcus, as you can see here, that this is considered as normal, which will most likely be in 2 to 3 mm, which is normal gingival sulcus. However, due to any reason, for example, as you can see here, this is accumulation of calculus. So when calculus is accumulated over here, it basically irritates this gingival tissue, and when it irritates this gingival tissue, it basically causes bacteria to accumulate over here, and the gingiva then recedes. And you can appreciate that this space you can see, which is now created, this, when periodontal probe is used, is more than 3 mm, and this is basically called as periodontal pocket. And this is one of the most important feature of any periodontal disease. In gingivitis, we do not appreciate deepening of the gingival sulcus because only gingiva is accumulated, only the gingiva is inflamed. However, in cases of periodontal pocket, we can appreciate that there is deepening of the gingival sulcus. So this is periodontal pocket, and the basic concept that you should know, differentiating between a healthy pocket and a periodontal disease pocket. Now, let's classify the pockets which are present in cases of pathology. First, we have gingival pocket, which is also called as pseudo pocket. Now, why is it called as pseudo pocket? Because there is no deepening of the sulcus, which stays above 3 mm. So that's why it is called as gingival pocket. And basically, there is enlargement of the gingival tissue. As you can see, for example, this gingiva can increase in size like this more than the normal tissue should be, but you can see that the gingiva is enlarged. So if you still use a periodontal probe, the pocket will not be more than 3 mm. It will stay below that. However, if in cases of periodontal diseases, this pocket will be enlarged. That is called as periodontal pocket. Now, what is periodontal pocket? Basically, there's destruction of this alveolar bone. We have periodontal ligament, cementum as well. So there's destruction of this tissue. Therefore, the gingiva recedes in the apical direction, and when it recedes, it basically leads to deepening of the gingival sulcus. And therefore, if you do not stop this process by prophylactic treatments such as scaling and other treatment as well, this is further deepen and it can lead to loss of touch. So this is the two classification, the most basic classification that you should know, the difference between and what actually is a gingival pocket, also called as pseudo pocket, and periodontal pocket. Now let's further talk about what are the different types of periodontal pocket. Basically, we have two type periodontal pockets. Let's talk about the first type. First is supra-bony pocket. Now, supra-bony pocket, also called as supraalveolar pocket, basically it's called as when the base of the pocket is coronal to the alveolar bone. I'll just show you in a picture what actually it looks like, which will make your concept further clearer. But for now, just remember that suprabony pocket is when the base of the pocket is coronal to the alveolar bone. In contrast to that, infrabony pocket, intrabony pocket, or you can also call it subcrestal pocket, is basically when the base of the pocket is apical to the crest of the alveolar bone. Now, what do we mean by these definition? Let's have a further look at it. Now, in this diagrammatic picture, you can appreciate that this is a normal tissue. You can see the bone is present over here, this bone, and this is normal. You can see there is no pathology associated with it. However, if you talk about suprabony pocket, now can you appreciate that this is the base of the pocket? You can see that this is the base of the pocket now. This alveolar crest is this region. So the base of the pocket is coronal to the bone. So this is called as suprabony pocket. However, in cases of infrabony pocket, you can appreciate that this is base of the pocket and this is crest. So the crest, the base of the pocket is present apical to the crest of the alveolar ridge. So in cases of suprabony pocket, the base of the pocket is present coronal to the crest of the alveolar ridge. However, in cases of infrabony pocket, the base of the pocket is present apical to the alveolar crest. So now, why is that? In cases of suprabony pocket, there is horizontal bone loss in this horizontal direction. However, in cases of infrabony pocket, the pocket is formed in a vertical bone loss manner. So, this is the basic concept that you should know, and that will actually help you in differentiating supra and infrabony pockets. Now, let's talk about periodontal ligament. Now, periodontal ligament is basically from which you can understand is periodontology. It's all about the periodontium, the structure which surrounds, supports, provides all kind of nourishment to the tooth is the periodontal ligament. The periodontal ligament is basically that connective tissue which surrounds the root and attaches it to the alveolar bone. You can appreciate that these are the different types of fibers which we'll discuss in future videos and talking about in detail because these fibers are really important. So these are the fibers, different type of fiber which collectively form the periodontal ligament, which basically attaches the tooth to the alveolar bone. Now, this periodontal ligament is continuous with the gingiva and it freely communicates with the bone marrow spaces. So, this is the basic concept that you should know for now about periodontal ligament. Now, at times there is granulation tissue formed due to gingivitis, periodontitis, which is inflamed tissue and it is continuously irritating the gingival tissue, and removal of it is very important when we are treating gingivitis and periodontitis. So, an important term and concept in periodontology is called as gingival curettage. Now, what do we mean by that? Gingival curettage simply means that there is removal or scraping of clavicular epithelium and chronically inflamed connective tissue, which basically are formed in the soft tissue pocket. And when you remove this inflamed tissue or chronically inflamed tissue, it basically allows the healthy tissue to flourish and therefore making the disease arrested, or you can say improving the health of the normal tissue. So this is called as gingival curettage, and this is a very important procedure in periodontics because this actually helps patients to treat who are suffering from gingivitis and periodontitis. So, in this video, we talked about every basic concept and terminology which you should know before you actually jump on towards advanced periodontology. So, we started off with different definitions. For example, we started off with plaque, calculus, materia, alba. Then we talked about the different types of oral mucosa which are present. Then we further talked about the different anatomical types of gingiva. Then we talked about different types of pockets. And lastly, we talk about gingival curettage. So, I hope this video was useful for you. And if you like this video, please like, share, subscribe, and press the bell icon. Thank you for watching this video. See you next time.